Shock. Shock is a life-threatening clinical symptom which is characterized by an acute reduction in the effective circulating blood volume, hypotension, low blood pressure, inadequate perfusion of the cell, the tissue hyperfusion. Classification and etiology. Hypovolemic shock. It is mainly seen in acute hemorrhage, burn, dehydration from vomiting and diarrhea, excessive use of diuretic, cardiogenic shock. It may seen mainly in condition like myocardial infarction, heart attack, cardiomyocytosis, pulmonary embolism, tension pneumothorax, cardiac arrhythmia. Septic shock, gram-positive septicemia, exotic shock, infection with streptococci, pneumococcus gram-negative septicemia, cardiogenic shock, effect in E. coli, pseudomonas, cliche. Traumatic shock, it may be seen during several injuries, surgery with mixed blood loss, obstetric trauma, neurogenic shock. It may be seen in cervical spinal cord injury, several head injury, and complication of spinal anesthesia. Hypoadrenal shock. It may be seen in secondary adrenal insufficiency as in case of metastatic disease, tuberculosis, adrenal atrophy, addiction disease. Pathogenesis. Hypovolemic shock, septic shock, decrease effectiveness blood volume, decrease venous return to heart, increase cardiac output, decrease blood flow, decrease supply of oxygen. Cardiac shock, traumatic shock, neurogenic shock, hypoadrenal shock, decrease cardiogenic output, decrease blood flow, decrease supply of oxygen. In general, all forms of shock involve following dearrangements: reduce effective circulating blood volume, reduce supply of O2 to the cell tissue with resultant anoxia, inflammation mediator toxin which is released by shock induced cellular injury. Pathogenesis of hypovolemic shock. Hypovolemic shock mainly result due to inadequate circulating blood volume which is more often related to hemorrhage. It may lead to decreased cardiogenic output, low intracardiac pressure. Major clinical feature including tachycardial hypotension, decreased urine output, alternating in the mental state. Pathogenesis of cardiogenic shock. It may result due to several left ventricle dysfunction as in case of acute myocardial infarction. This is result decrease in the cardiac output which further lead to decreased tissue perfusion. Clinical feature of patient including increased intravenous pressure, pulmonary edema, hypotension, cold extremities. Pathogenesis of septic shock. Sepsis is the response of body to the bacteremia or endotoxemia. It may be produced by gram-positive, gram-negative bacteria or other several pathogens. Several sepsis may result in presenting hypotension leading to septic shock. The endotoxin or other harmful secretion produced by these pathogenous organisms lead to peripheral vasodilation. This further lead to ventricular dysfunction, result in persistent hypotension. Clinical feature include sign of infection include fever, tachycardia, war extremities, consolidation in chest, abdominal tenderness, alternate mental states. Pathogenesis of neurogenic shock. In neurogenic shock, there is a hypotension with tachycardia. Hypotension with tachycardia, which result in the shock, may even lead to cardiac arrest. Clinical feature in neurogenic shock mainly induce low blood pressure, rapid heart rate, dehydration, profuse weakness, confusion or coma, stage of shock. It may be divided into compensated non-progressive shock, progressive decomposition shock, irreversible decomposite shock, composite non-progressive shock. In this early stage of shock, attempt in made by maintain the adequate blood supply the vital organ. It is the condition which has caused the shock adequate treated, then the compensatory mechanism of the body may bring about the recovery, reestablish the hormone circulation. This called compensatory and reversible shock. This compensatory mechanism mainly include widespread vasoconstriction. In response to the hypotension, there is widespread and vasoconstriction which act to increase the peripheral resistance with thereby further increasing heart rate, blood pressure, fluid conversion by the kidney. Kidney help to improve the venous return to the heat, assist to restore the blood volume by reduce GFR, release of aldosterone by activation of renin-angiotensin mechanism, release of antidiuretic hormone ADH, stimulation of adrenal medulla. In response to low cardiac output, the adrenal medulla is stimulated to release excess of catecholamine, which further increase the heart rate and cardiac output. Progressive decomposition shock. In this stage, even the compensatory mechanism in the body activate, but due to certain risk factor or associated stressful condition, the shock condition remain persistent. Therefore, it results in progressive decomposition shock, pulmonary hyperfusion, resulting in progressive acute respiratory distress syndrome (ARDS), tissue ischemia result due to hypoperfusion, which may further lead to metabolic lactic acidosis. Irreversible decomposition shock. It takes place when the shock is so severe that the compensatory mechanism of the body associated treatment are not able to compensate the damage. It is caused due to various factors like progressive vasodilation caused due to anoxic damage to the capillary artery, increased vascular permeability caused to action inflammatory mediator, anoxic damage to vital organ like hemorrhagic, like kidney and brain, hypercoagulability of blood, contribution to slowing of blood stream and vascular thrombosis. Clinically at this stage, patient has fracture of coma, poor heat function, progressive failure. Change take place in shock. Change in brain hypogenic encephalopathy. Cerebral ischemia is composed shock. Lead to attain the state of consciousness. Grossi, the cerebral artery, suffer from severe ischemia. Necrosis, microscopic change are visible in the ischemia is prolonged to the 12 to 24 hours. The neuron are more prone to get damaged due to effect of this ischemia. In the blood pressure progressive fall below 50 mm of Hg, the brain may suffer from severe ischemia damage leading to loss of critical functional and coma. Change in heart. There may be small or large ischemia area, or in fact heart may yet affected in cardiogenic as well as in other form of shock. There are area zonal region near the intracatheter disc characterized by opaque to transverse band. Change in lungs. It is largely affected in septic shock. Grossy lung home become heavy and weak. Microscopically, there is a congestion and along with alveolar intestinal edema, they may also be thinning and fibrous of the alveolar septa. Change in kidney. Real ischemia followed by systemic hypotension. It is considerable responsible for renal changes in shock. Grossly, the kidney became soft and swollen. Microscopically, the tubular lesions are seen. All the level of nephron may lead to acute tubular necrosis. The end result of this generally annual change in liver. Glossy liver show faint nutmeg appearance. Microscopically, it may show ischemic shrinkage, focal necrosis, or fatty change. Complication of shock, acute respiratory distress syndrome (ARDS), acute renal failure, cardiopulmonary arrest, multiple organ dysfunction syndrome, cerebral stroke, and death.